The Department of Health and Human Services cutting $500 million in funding for mRNA vaccine research. Fox News senior medical analyst Dr. Mark Siegel spoke with the NIH director about those cuts.
It was a promising technology. It made sense to invest in it in 2020. It I think did a good job in protecting older people. It should never have been used or recommended or mandated for young people. The key thing is that the public trust in the platform is now gone. You can see that in the uptake numbers of despite almost universal recommendations for adults, you get less than a quarter of the people in the country are taking the boosters and taking the recommendations. BARDA's decision to cut the contracts makes sense. It still makes sense to invest in it for cancer. I mean, it's quite promising. I don't think it's quite there yet, but it's promising, and we should continue to invest in a research way, but we should not be using it as a platform for mass vaccination.
Dr. Mark Siegel joins us now. Dr. Siegel, you sat down with him. You talked to him about mass vaccination. The American public really doesn't trust it after COVID, right? So what is he doing to restore trust in the health community?
And that's exactly the key. Dr. Bhattacharya was talking to me about restoring trust in public health, in our leaders, and he's saying basically we pivot. He's looking now to use mRNA technology more for cancer, less for COVID like before. Mm-hmm. And he focused on vaccines, and he talked to me more about what the future of vaccines are in this country with the NIH. Take a look.
The secretary had invested in a new platform called essentially like a whole virus inactivated vaccine, the BPL inactivated. It's actually quite promising. It actually relies on an old idea, but it deployed in a new way. Quite promising for the flu, potentially even a universal flu vaccine where you take the vaccine once and don't have to take it again. Now, there's still a lot of testing that still needs to be done. For COVID, there are already alternatives. As you mentioned, Novavax that uses a protein subunit platform. So there are other technologies available for COVID.
So the key here is moving forward to the future. And Dr. Bhattacharya wanted to see ways that the NIH could be changed, could be cut, could be streamlined, separate the wheat from the chaff, and get Americans to live longer and to live better lives. Take a look.
When I first got into the office about 4 months ago, there was a lot of sort of parts of the NIH portfolio devoted on things that, frankly, didn't really produce much health. DEI, the sort of like misinformation control, essentially used to censor people, things like that. We've basically systematically tried to put in processes to not have that, because the mission of the NIH is too important. The mission of the NIH is to do research that improves the health and longevity of the American people. I mean, the longevity of the American people hasn't increased since 2012, Mark. I mean, the life expectancy has been flat. The NIH needs to solve that problem.
Has he done a good job of putting our concerns at rest?
I think public health, it varies. There's a lot of division, but I think a lot of people are getting their confidence in public health restored here. Remember, the future, and he spoke to me about this also, is personalized medicine, is artificial intelligence, is biotechnology. And I felt in that interview his excitement for those things came across, and that's something that Americans can focus on.
When it comes to the mRNA vaccine development, I was doing a little research about it. It instructs cells to produce specific proteins, which can actually treat diseases and rare forms of cancer. So will they continue? I know they cut the $500 million. Will they continue the research, though, for cancers? Because when you're diagnosed, you'll try anything.
You know, what you just said, you said that exactly right. That's what it does. It gooses up the immune system to fight things, foreign things, and cancer. And listening to Bhattacharya, it sounds like exactly that they're behind that. And I'm behind that. And I think that research has to continue. It's very exciting for the future in the fight against cancer. Yeah. Absolutely.
Yeah, he said it's just not ready for prime time. Thank you so much, Dr. Siegel. Great job with him.
Thank you. Thank you.
President Donald Trump signed an executive order Tuesday aimed at improving ways to identify and treat pediatric cancers using artificial intelligence. Specifically, the executive order instructs the Make America Healthy Again Commission to work with the White House's Office of Science and Technology Policy to employ AI on how to use it to diagnose and treat childhood cancers and identify new cures. Health and Human Services Secretary Robert F. Kennedy Jr. spearheads the MAHA Commission. The president was joined in the Oval Office by Kennedy, Centers for Medicare and Medicaid Services Administrator Dr. Mehmet Oz, Director of the National Institutes of Health Jay Bhattacharya, and others. The president signed the order surrounded by children, many who have survived cancer themselves. The president said that in signing the order, the U.S. is adding another $50 million to the Childhood Cancer Data Initiative. I'm also directing the federal government to fully utilize artificial intelligence to supercharge pediatric cancer research, Trump said. It's pretty amazing what's happening. The president added, I want to just say that we're going to defeat childhood cancer once and for all. Trump's initiative in his first term establishing the Childhood Cancer Data Initiative has laid the groundwork for utilizing AI to administer clinical research and patient care to address pediatric cancers in the U.S., according to the White House. The effort has collected a host of information over the years, including tracking molecular characteristics and genetic information of childhood cancers that has already been organized in a vast database. Leveraging this data infrastructure, researchers will deploy artificial intelligence to improve clinical trials, sharpen diagnoses, fine-tune treatments, unlock cures, and strengthen prevention strategies using artificial intelligence. Researchers will be able to, for example, build scalable models to predict how a child's body responds to therapies, letting doctors forecast cancer progression and minimize treatment side effects, delivering better treatments that save more lives. Michael Castillo, director of the White House Office of Science and Technology Policy, told reporters earlier Tuesday. The executive order also will bolster funding for the Childhood Cancer Data Initiative, which is housed within the National Institutes of Health. It's a $50 million investment in the immediate future that we're announcing today, but there will be more investments to come as we start to implement this executive order, a White House official told reporters. As a result, the executive order also will be a funding call for research proposals related to the application of AI in childhood cancers, the official said. This is just a tremendous kind of application area where we have existing data sets, a lot of existing work that's been done over the past 6 years in this area, a White House official said. And it's something that's ripe for both scientific exploration and direct impact to the lives of these children. Meanwhile, the Trump administration's budget request calls for cutting funding from $7.2 billion to $4.5 billion for the National Cancer Institute within the National Institutes of Health for fiscal year 2026. However, the White House pushed back on characterizations that the administration was seeking to cut cancer research funding and said the budget for the next fiscal year is still being worked out. Government funding is set to expire at midnight, or else a lapse in funding will trigger a government shutdown. Pediatric cancer is the leading cause of death by disease after infancy in children, according to the National Cancer Institute. However, survival rates are on the rise. The 5-year survival rate for children between the ages of 0 to 19 years old is currently more than 83%, up from the 1970s rates of 58% for children aged 14 and under, and 68% for children between the ages of 15 and 19, according to the agency.